Imagine waking up tomorrow feeling completely fine, having your coffee, kissing your family goodbye, and then by noon you cannot speak your own name. That is a stroke. That is real life. I want to start by asking you something very personal. When was the last time you paid serious attention to how your body was feeling? Not just whether you were tired or a little stressed, but genuinely tuned in to the quiet signals your body was sending you. Most of us do not do that. We are too busy, too distracted, too convinced that the serious health events happen to other people, to older people, to people who are not as active or as careful as we are. And that assumption, that dangerous and deeply human assumption, is exactly what makes stroke one of the most devastating and preventable tragedies happening in our world today. A stroke does not announce itself loudly the moment it occurs. It whispers to you the day before, sometimes 2 days before, sometimes a week before. It sends quiet, easily dismissed, easily rationalized signals that something is going wrong inside the brain. And because we do not know what those signals look like, we ignore them. We take an aspirin, we lie down, we tell ourselves we are just dehydrated or tired, and we move on with our day. And then the next morning, or the next afternoon, the full stroke arrives. And by then, for too many people, it is already too late to escape without life-changing consequences. This speech is about that gap. That space between the warning and the event. That window of opportunity that most people never even know exists. Because if you know what a stroke looks like the day before it hits, you have a fighting chance. You can act. You can call for help. You can potentially save your own life or the life of someone sitting right next to you today. Let us begin with what is actually happening inside the brain when a stroke is about to occur. The brain is an extraordinary organ. It is the most complex structure in the known universe, running on a constant supply of oxygen-rich blood delivered through an intricate network of arteries and vessels. When that blood supply is interrupted or reduced, even briefly, brain cells begin to suffer. They do not recover quickly. They are some of the most sensitive cells in the human body, and when they are deprived of oxygen, they begin to die within minutes. There are two primary types of stroke. The first is an ischemic stroke, which is by far the most common, accounting for roughly 87% of all strokes. This happens when a clot blocks one of the blood vessels supplying the brain. The second is a hemorrhagic stroke, which occurs when a blood vessel in or around the brain ruptures and bleeds. Both are medical emergencies. Both can kill, both can leave survivors permanently disabled, and both, in many cases, give warning signs the day before they fully occur. Now here is something that most people have never heard of, and it is one of the most important medical concepts you will ever learn. It is called a transient ischemic attack, or a TIA. People in the medical community sometimes call it a mini-stroke, but that name is dangerously misleading because it makes it sound minor, manageable, something you can observe and wait out. A TIA is not minor. A TIA is the brain's emergency flare gun. It is the body screaming at you that a major stroke is coming and that you need to act right now. A TIA happens when blood flow to part of the brain is temporarily blocked, usually by a small clot, and then that blockage clears on its own. The symptoms can last anywhere from a few minutes to a few hours, and then they go away. The person feels normal again. And that is the trap. Because feeling normal again does not mean the danger has passed. Studies have consistently shown that somewhere between 10 and 15% of people who have a TIA will go on to have a full-blown stroke within 3 months, and nearly half of those strokes occur within the first 48 hours after the TIA. Let that sink in. Nearly half of the strokes that follow a TIA happen within 48 hours. This is not a slow-moving situation. This is urgent. This is life and death measured in hours. So what does a TIA look like? What does a stroke look like the day before it fully arrives? This is where we need to be very specific and very honest, because the symptoms can seem completely unremarkable at first glance. They can seem like things that happen to all of us from time to time, and that is precisely why they are so dangerous. The first and perhaps most commonly overlooked warning sign is sudden confusion, not the kind of confusion where you walk into a room and forget why you went there. This is a different quality of confusion. This is a sudden, disorienting fogginess where you cannot quite follow a conversation, where familiar words seem strange, where your thoughts feel like they are moving through water. People who have experienced TIAs often describe feeling as though their mind suddenly went offline for a few minutes. They could not understand what someone was saying to them even though the words were perfectly clear. They found themselves staring blankly at something they do it every day, like a stove or a door handle, unable to process how to use it. And then it passed, and they assumed it was nothing. The second warning sign is sudden trouble speaking or understanding speech. This is one of the hallmark symptoms of stroke in progress, and it can appear as a brief episode the day before. You might find yourself unable to get words out, or the words come out jumbled and wrong. You might slur your speech suddenly. You might say something that makes no sense and not realize it, or you might realize it and be terrified but unable to correct it. Someone might speak to you, and though you can hear them perfectly well, you cannot make sense of what they are saying. This symptom is deeply frightening, and often people who experience it feel so embarrassed or confused by it that they do not tell anyone. They wait for it to pass, and when it does, they decide not to mention it. That decision can cost them their lives. The third warning sign is sudden weakness or numbness on one side of the body. This is extraordinarily important. If you suddenly notice that one arm feels heavy or weak, that one side of your face feels numb or drooping, that one leg is not cooperating with you the way it normally does, please do not dismiss this. This is one of the most classic neurological signs that something is wrong in the brain. It does not have to be dramatic paralysis. It can be subtle. A feeling of heaviness, a tingling that is distinctly on only one side of the body, the inability to grip something properly with one hand when moments before you were perfectly fine. These are signals. These are the brain telling you that blood flow is being compromised. The fourth warning sign is sudden vision problems. This can take several forms. Some people experience sudden blurred vision. Some experience double vision. Some experience what they describe as a curtain or shade being drawn across one eye, or a sudden loss of peripheral vision, or even a brief total blackout in one or both eyes. Vision problems related to stroke are particularly significant because they can be very brief and very sudden and then completely resolve, which leads people to assume they simply need glasses or are spending too much time looking at screens. But sudden vision changes that come on without warning and affect one eye or one visual field are serious neurological red flags that need immediate medical attention. The fifth warning sign is a sudden and severe headache, unlike any you have ever experienced before. Neurologists and emergency physicians have a phrase for this. They call it a thunderclap headache. It is a headache that reaches peak intensity almost instantly, sometimes within seconds. It feels different from any headache you have had before. It is not the gradual build of a tension headache or a migraine. It arrives with the force of something breaking or bursting. This type of headache is particularly associated with hemorrhagic stroke, where a blood vessel ruptures, and it is an absolute emergency. If you or anyone near you experiences this, the time to act is immediately. The sixth warning sign, and one that is frequently overlooked because it seems so benign, is sudden dizziness or loss of balance. Not the kind of dizziness you get when you stand up too quickly. Not the lightheadedness from not having eaten enough. This is a sudden, unexplained disruption to your balance or coordination. You might suddenly feel as though the room is spinning. You might stumble or feel genuinely unsteady on your feet for a period of time, and then it passes. Some people experience sudden difficulty walking, where their gait becomes uncoordinated and they cannot seem to move their legs the way they intend to. When dizziness or balance problems occur suddenly and without a clear cause, they deserve serious medical evaluation. Now I want to talk to you about something beyond individual symptoms, because knowing the symptoms is only part of this. The other part is understanding the pattern. One of the things that makes the warning signs of stroke so easy to miss is that they often occur in combination and they resolve quickly. A person might have a few minutes of blurred vision, followed by a brief headache, followed by feeling unusually confused or off balance. And then all of it passes. And because they feel normal again, they rationalize each symptom away individually. The vision thing was from staring at a screen. The headache was stress. The confusion was tiredness. But what they were actually experiencing was a cascade of neurological symptoms that should have sent them to the emergency room immediately. There is a well-known acronym used in stroke education, and while many of you may have heard it, I want to say it again here with full intention and weight, because it matters. It is FAST. F stands for face drooping. Is one side of the face drooping or numb? Ask the person to smile. Is the smile uneven or lopsided? A stands for arm weakness. Is one arm weak or numb? Ask the person to raise both arms. Does one arm drift downward? S stands for speech difficulty. Is the speech slurred or strange? Ask the person to repeat a simple sentence. Can they do it correctly? T stands for time to call emergency services. If you see any of these signs, call emergency services immediately. Do not wait. Do not drive yourself to the hospital if you can avoid it. Do not take an aspirin and lie down. Call for emergency help right now. But I want to go beyond FAST today, because stroke education has expanded and the acronym has been updated in many medical communities to BE-FAST. B stands for balance. Has there been a sudden loss of balance? E stands for eyes. Is there sudden trouble with vision? These two additions are critically important because balance problems and vision changes are often the earliest and most overlooked warning signs, particularly for strokes that affect the back part of the brain, known as the posterior circulation strokes. These strokes can be missed even in hospital settings if clinicians are not specifically looking for them. I want to spend a moment talking about who is most at risk, not to frighten anyone, but because awareness of your own risk profile is one of the most powerful protective tools you have. High blood pressure, also called hypertension, is the single most important modifiable risk factor for stroke. It damages blood vessels over time, making them more vulnerable to blockage and rupture. If you have high blood pressure and it is not well controlled, your risk of stroke is significantly elevated. If you do not know what your blood pressure is, please find out. It costs nothing to check, and it could save your life. Diabetes is another major risk factor. People with diabetes have higher rates of atherosclerosis, which is the buildup of plaques inside arteries, and this significantly increases the risk of clot formation. Smoking is a powerful risk factor because it damages blood vessels, reduces oxygen in the blood, and increases the tendency of the blood to clot. High cholesterol contributes to plaque buildup in arteries. Atrial fibrillation, which is an irregular heart rhythm, dramatically increases the risk of stroke because it allows blood to pool in the heart and form clots that can then travel to the brain. Being physically inactive, drinking heavily, and having a diet high in processed and salty foods all contribute to stroke risk. But here is what I need you to understand clearly. Stroke does not only happen to elderly people. It does not only happen to people who are obviously unwell. It does not only happen to people who have lived unhealthy lives. Stroke is happening to people in their 30s and 40s in increasing numbers. Young adults who appear perfectly healthy are having strokes. Athletes are having strokes. People without any known risk factors are having strokes. This is not meant to create fear without purpose. It is meant to dissolve the dangerous myth that stroke is something that only happens to other people who are older or sicker than you are. There is another dimension to this conversation that I think is critically important, and that is the role of stress and emotional state in the days leading up to a stroke. Research has shown that extreme emotional stress, significant physical exertion beyond what the body is used to, and even sudden shocks or frights can trigger strokes, particularly in people who have underlying cardiovascular risk factors. People often describe the days before their stroke as unusually stressful or exhausting. They were pushing through something physically demanding. They were going through an emotional crisis. They had not been sleeping properly. They had been ignoring pain or discomfort for days because they felt they could not afford to slow down. This is part of the cultural problem we have built around health. We have normalized ignoring our bodies. We have turned self-sacrifice and pushing through pain into virtues. We celebrate people who go to work sick, who ignore symptoms in order to meet deadlines, who do not want to make a fuss or waste a doctor's time. And that culture is quite literally killing people. The body sends signals. Consistent, logical, meaningful signals. And when we make a habit of ignoring those signals, we are making a choice, even if we do not consciously recognize it as one. I want to talk about something that could quite literally make the difference between life and death, and that is what to do in the crucial minutes and hours after you notice warning symptoms. Whether those symptoms resolve or not, you must seek emergency medical evaluation immediately. This is not something that can wait until morning. This is not something where you should observe the situation for a few hours and see how you feel. When it comes to stroke, time is brain. Every minute that passes during a stroke, approximately 1.9 million neurons die. Neurons are the irreplaceable cells that allow you to think, speak, move, remember, feel, and be yourself. Every minute of delay in treatment is a minute of permanent damage. If a person is having a stroke and they arrive at a hospital quickly enough, they may be candidates for treatments that can dramatically reduce the damage. Ischemic strokes can be treated with a clot-dissolving medication called TPA, which stands for tissue plasminogen activator, but it must be administered within a specific window of time from the onset of symptoms, typically within 4.5 hours. There are also mechanical clot removal procedures called thrombectomy that can be performed within a longer window for certain patients. The point is that these treatments exist, they are effective, and they save lives and function, but only if the person gets to the hospital in time. If you experience any of the warning symptoms I have described, even briefly, even if they resolve and you feel completely normal again, please go to the emergency room. Please call emergency services. Please do not downplay what happened. When you speak to medical staff, be specific. Tell them exactly what you experienced, when it started, how long it lasted, and what it felt like. Do not minimize it. Do not apologize for coming in. You are not wasting anyone's time. You are potentially saving your brain and your life. Now I want to address something that is very human and very understandable. Many people know on some level that something is wrong. They notice the symptoms, they feel the strangeness, but they do not want it to be serious. There is fear in seeking help, because seeking help makes it real. There is denial, because denial is a powerful and sometimes comforting mechanism. There is guilt about alarming family members or missing obligations. There is financial concern about the cost of medical care. There is embarrassment about what others will think. All of these feelings are real and valid, and all of them can be deadly when it comes to stroke. I want to speak directly to that fear right now. I understand that walking into an emergency room or calling an ambulance feels like a dramatic and definitive act. It feels like crossing a threshold you cannot uncross. But consider the alternative. The people who wait, who hope the symptoms will go away, who try to sleep it off, who do not want to cause a scene, those are the people who wake up unable to move one side of their body. Those are the people who lose the ability to speak. Those are the people whose families receive phone calls that change everything. Your discomfort about seeking help is not worth that price. You are worth getting care. Your life is worth an emergency room visit that might turn out to be nothing, because the visit that turns out to be something could be the one that saves you. Let us talk about what you can do right now, today, to lower your risk and improve your readiness. The first thing is to know your numbers. Know your blood pressure, know your blood sugar, know your cholesterol levels. These are the hidden forces working inside your body every day, and without knowing them, you are navigating your health blindfolded. Make an appointment if you have not had a checkup recently. Preventive care is not optional, it is foundational. The second thing is to understand your personal risk factors and take them seriously. If you are a smoker, know that stopping smoking is one of the most powerful things you can do to reduce your stroke risk, and that this reduction in risk begins almost immediately after you stop. If you have high blood pressure, work with a healthcare provider to manage it. If you are living with diabetes, prioritize your blood sugar management. If you have atrial fibrillation, make sure you understand your treatment options because appropriate anticoagulation therapy can dramatically reduce stroke risk in patients with AFib. The third thing is to be physically active in a way that is sustainable for your body and your life. Movement is medicine. Regular moderate physical activity improves cardiovascular health, helps maintain healthy blood pressure and weight, reduces stress, and improves circulation. You do not have to run marathons or spend hours in a gym. A 30-minute walk most days of the week is genuinely meaningful for your cardiovascular health. The fourth thing is to look at your diet. A diet that is high in fruits, vegetables, whole grains, lean proteins, and healthy fats, and low in processed foods, excessive sodium, and added sugars, supports healthy blood vessels and reduces many of the risk factors associated with stroke. This does not have to be a dramatic overhaul. Small, consistent changes made over time add up to a meaningfully different risk profile. The fifth thing is to manage your stress in deliberate, intentional ways, not just accepting stress as the cost of a busy life, but actively building in practices that regulate your nervous system. Sleep enough, rest, prioritize quiet, build relationships that restore rather than drain you. Make space for joy and ease in your life, not as luxury items, but as health necessities. The sixth, and perhaps most immediately practical thing, is to share this information. Talk to your family. Talk to your parents and grandparents. Talk to your partner and your children if they are old enough to understand. Make sure the people closest to you know what the warning signs of stroke look like, and make sure they know what to do if those warning signs appear. Because in a stroke situation, you might be the person who cannot help yourself. You might be the one who needs someone else to recognize what is happening and make the call. The person standing next to you knowing these signs could be the difference between your full recovery and a lifetime of disability. I want to close with something that I hope will stay with you long after you leave this room today. Every year, millions of people have strokes. Millions of those strokes were preceded by warning signs that were noticed and dismissed. In the quiet aftermath of stroke, in the rehabilitation centers and the hospital rooms and the difficult silence of families who are adjusting to a new and harder reality, people ask themselves what they missed, what they dismissed, what they could have done differently if they had known. You now know. You know what the warning signs look like. You know that the day before a stroke can be a day of opportunity, a day when the right action can change everything. You know that sudden confusion, speech problems, vision changes, weakness on one side of the body, severe headache, and loss of balance are not symptoms to sleep off or explain away. They are signals. They are the brain asking for help. You know that time is the single most critical factor in stroke outcomes, that every minute matters, that treatment exists and it works when it is delivered in time. You know that stroke is not inevitable, that it is not only something that happens to other people, and that the choices you make about your health every day are shaping your risk right now. What I am asking you to carry out of this room today is not fear. Fear is paralyzing and rarely useful on its own. What I am asking you to carry is awareness. Awareness of your body and its signals. Awareness of the people you love and the signals they might be sending. Awareness that acting quickly and decisively in the face of these symptoms is not an overreaction. It is wisdom. It is exactly the right thing to do. A stroke does not have to be a story that ends in tragedy. For many people, because someone knew the signs, because someone acted fast, because someone refused to dismiss what they were seeing, the story ends with full recovery. With life continuing, perhaps with new priorities and new gratitude, but continuing. That is the story I want for every one of you. That is the story you deserve. Please take this information seriously. Please share it with everyone you know. And please, if you ever find yourself experiencing sudden, unexplained neurological symptoms, do not wait. Do not rationalize. Do not minimize. Act. Your brain is irreplaceable, your life is irreplaceable, and the knowledge you now carry could make the difference between someone's worst day and their best chance. This is Dr. Mark reminding you, listen to your body, act on warning signs, and never ignore sudden changes. Quick decisions save brains, save families, and save lives every day.